Hi, good afternoon. Thank you, Jen. Thank you, everyone, for joining us. We'll do the same format. So as expected, the Thanksgiving holiday with people spending more time together indoors, colder weather, new cases of COVID-19 nationwide and in Virginia are up. In our district right now, they remain essentially plateaued, but looking at our surrounding regions, we do expect that they are going to go up as well. The New River Valley tends to run a week or so behind Mount Rogers and Roanoke, and they've seen some increases in their caseloads. So we do have our epi curves, I believe. So this is district-wide. You can see that things have overall kind of been at a plateau for the last several weeks, and that far right one may go up a little bit as we fill in. If we go to the next one, I think that's Montgomery County. Again, there was a slight increase last week, and we sort of expect that the far right bar is going to fill in just like that one did. And I think we'll just go through. Radford City, of course, already a slight increase, but again, I remind you, look at the y-axis, the numbers we're talking about. And remember, these aren't daily, these are weekly cases. That y-axis is really important. Same thing with Floyd. They've kind of been up and down, hovering between 20 and 30 cases per week for several weeks now, and we expect it to either stay there or even increase a little bit. Giles County, same thing, kind of hovering between the 20 and 40 cases per week. So we do expect to see that right bar fill in as well. And Pulaski, much of the same, kind of trending more into the 50 to 60 cases a week. And we may see an increase even more than that. And then if we look at school-age children, again, they peaked in early September. And have come down since then, kind of plateaued. And we may see, again, in the 20 to 40 range, or it may go up a little bit depending on our community cases, because we do know that 70% of transmissions occurring in the home. And then I think our last one is the group ones. Again, universities contributing very little to our COVID cases. Mainly it's our community. And as I said, as our community cases go up, we see where our school-age children go up as well. I think that's all we had for the epi curves. So all of our communities in the New River Health District are considered to be at high community transmission defined by the CDC. So remember, Department of Labor and Industry requires all employers mandate indoor masking in areas of substantial or high transmission, regardless of distancing and vaccination status. This morning, our hospitals reported 29 COVID-19 positive patients. That's between low scale, Pulaski, Montgomery, and Carilion, Giles, and New River. The hospitals remain very busy. They're often at capacity with patients holding in the emergency rooms waiting for beds. And this is not all necessarily COVID, but from other medical issues and other seasonal illnesses. As I've said, we started with a somewhat early flu season and predominantly flu A, the H3N2 variant, which tends to be more severe and can present more symptoms. We saw that with our college kids. So we're seeing people who have flu and COVID, or flu or COVID. So we are continuing to ask people who have those symptoms to get tested for both. In addition to flu and COVID, we are seeing a significant number of pertussis cases right now in the district. Pertussis is also called whooping cough because of its noticeably high-pitched barking cough. Pertussis is another highly contagious respiratory transmitted virus, and people at most risk are pregnant women, babies, the elderly, and people with weakened immune systems, asthma, or those with waning immunity. Most people have been vaccinated against pertussis. You get it in your DTaP vaccines as children, and then on those 10-year booster tetanus shots, the Tdap. Mainly people think about it as a tetanus shot, but it does have that pertussis booster. If you need a booster or you don't remember when your last shot was, now's the time to go ahead and get one. Pregnant women, it's recommended that they get a Tdap booster with every pregnancy because of the risk. COVID-19 cases are almost exclusively Delta variant in this area and in Virginia right now. Labs are sequencing about 1 in 7 of the PCR tests, and that's the sequencing is how the Omicron variant would be detected. The state labs did go back and look at samples from past weeks, specifically for Omicron, and didn't find it. However, if it's not here, it will be. So, just like Delta, you're not going to hide from it. It's going to be everywhere. Obviously, we're learning as we go. We're seeing it as we go. Scientists are still evaluating how transmissible and how severe the Omicron variant is compared to the prior ones, the Delta and the Alpha, that caused our surges in early September and back over last January, February time. There's a fair amount of good evidence suggesting it is more transmissible than Delta, which was more transmissible than the original Alpha, which was more transmissible than the original COVID from 2020, and we'll continue to follow the course. If it does kind of follow the pattern of other pandemics and just the way viruses evolve, that evolutionary pressure, it may be less severe as far as illness, but more transmissible. That's how they evolve. And so if so, again, that's hopefully another step towards kind of getting into that endemic phase. At this point, COVID is pretty much everywhere. I think we're accepting that it's not going to go away. We have a very safe, effective vaccine, and we know that those who are ending up really sick or ending up in the hospital on the ventilators in the ICU, and those who are dying, the majority of those folks are people who are not vaccinated and those with other underlying conditions. But the Omicron variant doesn't change our advice. We continue to advise everyone to get vaccinated, and when eligible, go ahead and get a booster shot. I will remind people that the CDC does recommend now that those 18 and older get a booster shot. So everyone 18 and older, it's recommended to get a booster shot. For the Johnson & Johnson, it's at least 2 months after the first shot. For the Pfizer and Moderna, it's at least 6 months after the second shot. And you can mix and match vaccines. That's determined to be effective and very safe. And you can go ahead and choose what you get your booster with. We also do continue to recommend layered mitigation, such as masking and respiratory hygiene, hand hygiene, and distancing, in addition to optimizing ventilation of indoor spaces when gathering. Currently, we are vaccinating everyone who's age 5 and up, everyone the vaccine has been authorized for. Vaccines are available at pharmacies in the area, both our local pharmacy partners and national chain pharmacies. They're also available at our pediatricians' offices and some of our family medicine offices as well. And then the health department does continue to vaccinate at sites across the district. Our typical schedule is Mondays and Thursdays at the Montgomery County Health Department in Christiansburg, Tuesdays at the Floyd Health Department, Wednesdays in Pulaski and Giles, and on Fridays in Radford. This week, with some other special events, we are vaccinating every day at Montgomery, and people can take advantage of that. Also, this Saturday, one of our partners, the Farmhouse Pharmacy in Floyd, is offering walk-up vaccines at the Floyd County Rescue Squad from 1 to 7 p.m. We also want to remind women who are getting a booster to check with their doctor if they are going to be scheduling a mammogram. People who have received the COVID vaccine can have some swelling of the lymph nodes in the underarm of the side that they got the shot. It's much more common after booster or additional doses than with the primary vaccine series. The swelling after the vaccine is a normal sign that the body is, building that immunity, but that swelling could be evaluated as an abnormality on the mammogram. So, please check with your doctor and radiologist. Some experts recommend getting the mammogram before getting the booster, or waiting at least 4 to 6 weeks after getting the booster before you get your mammogram. And the last thing, again, we're talking about the holiday gatherings and holiday travel. Our best advice remains that everyone has to do a risk assessment, a personal and family risk assessment of how much risk they're willing to accept and can tolerate, and make those plans accordingly and let that inform behavior. Right now, pretty much universally across the country, it's high transmission. So you have to assume COVID's pretty much everywhere. And remember right now that the Delta variant is predominant, and we're following Omicron very closely. Then COVID can lead to poor outcomes for those at higher risk. So those who are young and healthy and vaccinated will likely behave differently from those who are older and more vulnerable, or from someone who lives with more vulnerable folks or young children who can't be vaccinated. Right now, there are no requirements about vaccines for travel or booster shots. Again, that's part of everyone's individual personal risk assessment. I will say that there are requirements as far as international travel and testing, whether vaccinated or not, before returning to the United States. We do continue to recommend those who are unvaccinated or those who are with unvaccinated people or with highly vulnerable people should mask, especially indoors in poorly ventilated spaces. It's always better to meet outdoors if possible. Try to avoid big crowds, wash hands, follow good respiratory hygiene. Those with respiratory symptoms such as the cough, stuffy nose, runny nose, fever, headaches, go ahead and get tested for both COVID and flu. And please, if symptomatic, stay home from work or school. It's just good infection control precautions for both for COVID and a lot of other things too. Simple hand washing is hugely successful in infection control and disease prevention. Hand washing helps prevent hepatitis A. We recently had hepatitis A outbreak here in Roanoke, and that can present some very serious outcomes. So what works for COVID is working for the flu, RSV or respiratory syncytial virus, and whooping cough as well. So I think that's all I had, and we'll go ahead and take some questions.
Thank you for that. At this time, I see no questions. Again, if you have any, please feel free to ask those using the chat or the Q&A. So we'll give it just a couple seconds here and we'll see if anything pops up. But it doesn't appear at this time we have any questions today. Your update was so thorough. That's what it was. Oh, here we go. How unusual, Tom is asking, how unusual is an outbreak of whooping cough?
So our experience in our district is every 2 to 3 years, we'll have a pretty significant rise in cases and outbreaks of whooping cough. The tetanus booster, which is the main way to get that prevention, the pertussis vaccination, the Tdap, is recommended every 10 years, which is perfect for tetanus. For the pertussis, it's probably stretching it a little bit longer. It is out there, and we definitely recommend, if you don't remember when that last Tdap was, or if it's been close to 10 years, to go ahead and get that booster shot. As I said, pregnant women, I think I said pregnant women get a Tdap booster with every pregnancy because it's high risk to pregnant women and to infants.
Okay. Again, I see no questions at this time, so I think we're going to end it here today, and we'll catch up again with you next week. Thank you again for joining us today.
Thank you, everyone. Thanks, Jen.